Hi everyone, thanks for joining me in the third part of my journey with kidney disease, kidney failure, dialysis, and transplantation. Just a quick request before I begin. I am currently on dialysis and require a kidney transplant. If you would like to be a live kidney donor, then please do reach out to me by my social media. The wait for a kidney from a deceased donor in the UK is up to 2 to 3 years. However, from a live kidney donor, it would only be 3 to 6 months, where we would do some matching to see if your kidney is a match, and then we could go ahead with a transplant. I would like to take this opportunity to thank my previous live kidney donors who wanted to donate but were unable to, unfortunately. So anyway, continuing with today's video. Today I'm going to talk about what happens after a kidney transplant fails. Now, I don't think this is talked about enough in social media or YouTube videos. People always like to discuss when they have a kidney transplant. However, no one wants to tell the story after the transplant fails, which makes sense because it's not a nice time to it's not a nice experience. But as I am going through this process at the moment, it makes it easier for me to talk about it. So as you heard in the previous videos, in part 1 and part 2 of my journey, I had chronic kidney disease that turned into kidney failure. I had to go into dialysis, and luckily and very bravely, my sister donated her kidney to me. That kidney transplant lasted for about 12 years, and my kidney transplant failure happened in 3 stages, which I'm going to talk about. So in 2020, my kidney transplant, after 10 years, showed signs that it was going to fail. This is because my creatinine levels went slightly higher to about 200. A normal person's creatinine levels should be about 120. However, over the years, mine started to increase slightly. So it went to about 140, then a couple of years to 180, and then in 2020, it went up to 200. My consultant said that this could be because of some type of antibody rejection due to antibodies, or that the previous disease that I had, which was IgA nephropathy, had come back again. At the time, I didn't want to believe that my kidney transplant was failing, obviously, and I was in complete denial. Just like the first time when my kidneys were failing, I was in denial because my health had been so good at the time. I could do whatever I wanted. I had so much freedom when I was a teenager that I didn't want to believe that I was having kidney failure, and I thought maybe my blood test results had been confused with someone else's or something like that. But after about the 10th blood test, I had to kind of deal with the situation and come to terms with the fact that I did have kidney failure. And this time, when my kidney transplant was failing, it was kind of like the same thing was happening again. And I was in denial again that anything bad would happen because I had been looking after myself and I didn't believe that I'd done anything that was incorrect. So I'd been following a really good diet. I wasn't excessively overweight. I've been drinking so much water, so I was drinking about 4 to 5 liters of water a day for the whole duration that I had the kidney transplant. I never missed my medication doses, and I just didn't feel like, why is this happening to me? And I thought that I haven't wronged anyone or done anything that was really bad, that this should be happening to me. Um, but then after a couple of weeks, again, I had to come to terms with it. And I thought maybe if it's just my kidney function stays stable and my creatinine levels stay at 200, then that would be fine. Because when you have a kidney transplant, it's not about how well the kidney is functioning. So it doesn't matter if your kidney function is at 80%, 60, 70, even 30, 40, 20, even. As long as it stays stable, you can live a relatively good life with a lot of freedom in your diet and drink whatever you want. So after about a year in 2021 or 2022, I unfortunately suffered from esophagitis, and this is where you develop ulcers in your esophagus which bleed internally. There aren't any signs that this is happening, and there's no kind of pain to tell you that you have ulcers in your esophagus. So at the end of 2022, I just fainted and had seizures, and this was a sign that my body was losing a lot of blood and trying to stay alive, because I fainted, and then I tried everything to rehydrate myself because I thought maybe I was dehydrated. But I just kept fainting and having seizures. I even had a seizure at the A&E, um, where they were then able to do some scans and blood tests to find out what was going on. This esophagitis was caused primarily by the anti-rejection medications that I was on, the one being Cellcept. And because my kidney transplant was failing, the medication was not metabolized properly by the kidneys. This meant that I had a lot of the side effects of that medication, which are primarily gastrointestinal, and one of these side effects was esophagitis and a hiatus hernia. So after I completed the treatment to get the esophagitis resolved, I had to come off that medication called Cellcept, and because of this, much of my immune system was now active, and there was no kind of barrier against rejection to the kidney because of that anti-rejection medication had been taken away. So in the beginning, I thought maybe it won't make that much difference, but unfortunately, only maybe after about 2 or 3 months, my kidney started to majorly fail. My creatinine levels went extremely high, so it went so high up to maybe to about 800, um, even over 1,000 as well. My creatinine levels were over 1,000, and this meant my kidney function was down to about 10 or 11%. And this was typically the time when I started talking about dialysis with my consultant. And at first, we discussed hemodialysis, whether I needed to go back on that, or if I could do CAPD, which is the continuous ambulatory peritoneal dialysis. At the time, obviously, my feelings were that I didn't want to go back on dialysis at all, because who wants to go back to having dialysis and having all those restrictions again? So I was extremely upset for a little while. I had many episodes and nightmares where I just felt like when my kidneys failed, then I was on dialysis, and at death's door again. Um, but again, you have to keep going and you have to keep moving and going in the direction of living again and surviving. And you always hear stories of people's kidney transplants that lasted for 20 years, 30 plus years, or even 40 years. And realistically, those are the stories that you will hear because people who are on dialysis whose kidney transplants have failed don't want to really talk about it because it's a very depressing topic that can often make you feel very sad because your transplants failed and now you're on dialysis, unfortunately, again. And who wants that? But people who aren't on dialysis and whose transplants have lasted such a long time, they're more likely to talk about it because it's a happy experience. But only a small proportion of patients, so maybe less than 1% of patients, will have a kidney transplant or organ transplant that lasts that long. And they will more often report their experience because, of course, it is a happy experience. But the majority of organ transplants, unfortunately, don't last as long. When you go into have a kidney transplant, you always think that you're going to be the exception to the rule and that your kidney transplant is going to last for that 30, 40 years plus. But the harsh reality is that it's probably only going to last about 10 to 15 years. And that's with taking a lot of care of yourself. I know for me personally, I took so much care of myself. I drank a lot of water, 4 to 5 liters of water. I had a very good diet. I exercised. Didn't even eat any meat. I'm a vegetarian. I didn't eat out either. I didn't eat processed foods. And I really did try my best to make the kidney transplant last for as long as possible. I wasn't overly obese at all. Still, if I've learned anything from this experience, it is that there are things in your life that are beyond your control, that are beyond the control of your doctor or your consultant. And you really have to try to make the best of what you have and what you're given, and the cards that you are dealt. So this is all the more reason to take care of yourself because you want to make the kidney transplant last as long as possible. And it also means that you have to try your best to get out there and do the things that you want to do. Obviously, do the things that you want to do within reason. Don't go out there and do something that's dangerous or that's not safe, but try to achieve what you want to achieve. If you have lifelong dreams or you want to pursue an education, then please do that as best as you can. Don't just sit at home and not do anything at all. Don't think that I'm going to do that later because I've still got my kidney transplant or organ transplant and I can go and do it later. Because the time goes so quickly that you don't even realize uh, where the time has gone and when your transplant is failing and then those opportunities are not possible anymore. So in at the end of 2022, I had the surgery to have a CAPD catheter put in, and that was traumatic again because as- after having a kidney transplant for 12 years, I had forgotten what pain was like, and all the procedures that you have to go through, all the surgeries, they are extremely painful. Even though you have anesthetic, it takes quite a while to recover from them. And it was a learning experience to get through those surgeries and deal with the pain and accept that I would actually have to be going on dialysis. I remember after my surgery, I found my stomach to see maybe they hadn't put the catheter in, maybe my kidney had recovered, and I wouldn't have to go on dialysis again. But I did feel the catheter in my stomach, and I thought, this is it, that I'm definitely having to go back on dialysis again. And it is something that you have to accept when you go through that process, that no amount of healthy living, praying, nothing is going to save you from the eventuality of going on to dialysis in order to survive. I had this surgery and I had to go into emergency dialysis, so I tried to do that CAPD dialysis a couple of days after because my creatinine has risen to about 1500, and this left me with a GFR, or percentage kidney function, of about 5 or 6%. And when that happens, you will suffer a lot of side effects of kidney failure. I remember the first time that I had kidney failure, I didn't have many of the side effects, such as swelling or fatigue, extreme fatigue, or tiredness, because I was so young. I was in my teenage years, so I was only about 17 or 18. And at that time, all your other organs are able to compensate for your kidney failure to some extent. However, this time I suffered a lot of the side effects. So I had a lot of swelling in my hands and feet, a lot of swelling in my face as well, and just over my whole body. At the time, I didn't realize, but I had a lot of breathing problems. And you don't realize because the process is happening so slowly of the kidney failing that every day you might not feel worse and worse, but because it's happening so gradually, it's really sinister. And at the end of the time when you have kidney failure, you can hardly breathe properly because all the fluid has filled in your lungs and your chest cavity, in your stomach, and it makes it very difficult to breathe. This made me extremely fatigued as well. So if you know me, then you know that I can't just go to sleep anywhere. So I can't just go to sleep on the sofa or on a chair or anywhere. However, when I had kidney failure this time, I just kept wanting to go to sleep on the sofa, at a table, on a chair, and I was experiencing extreme fatigue. So the difference between fatigue and just being tired is that when you are tired, you can just go to sleep for a couple of hours and then you'll feel fine afterwards. However, with this fatigue, you can go to sleep for like 10 or 11 hours, and even after that, you'll feel extremely tired after that as well, and you'll still want to keep going to sleep. So, this pattern of sleeping and waking and sleeping kept happening, and I kept getting very confused about the days and the date, and everything just kind of mixed and muddled into everything else. So, I couldn't really keep track of the time or day or night. Also, my blood pressure was extremely high, so it went to about 170 over about 110. And we tried various methods to control the blood pressure, but unfortunately, it just wouldn't go down. I was taking about 6 or 7 different types of blood pressure medications at this point, which also contributed to the fatigue and tiredness, but my blood pressure just wouldn't budge. We also tried a lot of different medications to try to stop the rejection from happening, but unfortunately, the pathology of rejection that happens earlier on in a person's kidney transplant journey is different to what happens later in the journey. So, in the beginning, it might be something to do with acute rejection or inflammation, which can be dealt with steroidal treatment. However, when it's later into a transplant journey, it's it's not likely to be due to inflammation. And I had a couple of biopsies as well to try to figure out what was going on, but they were inconclusive, and for that reason, they can't just give you medication because they don't know the cause of the rejection. And giving medication may actually make your condition much worse. So after I did CAPD for a couple of days, I found out that my exit site, so where they inserted the catheter, had started to leak. And this was because the exit site had not been able to heal properly because I did dialysis so quickly after the surgery. So straight after having the CAPD catheter put in a couple of days later, I had to have another catheter called a tunnel line catheter put in, much like I did in the beginning when I had kidney failure in 2010. And this allowed for the process of hemodialysis for a couple of days. So I had to do emergency hemodialysis for about 5 or 6 days in the hospital. And then I had to move to another center so that I could continue with hemodialysis for a slightly longer time until my CAPD catheter site healed. So I did hemodialysis, and it was extremely frustrating because the fluid limit in hemodialysis is very, very minimal. So you can only drink up to 500 to 700 milliliters per day. That was what the limit was for me. And this is so that fluid doesn't build up in between hemodialysis sessions, and so that so much fluid doesn't have to be taken off at the time of hemodialysis. So after about 2 months, I was able to continue again with CAPD dialysis, and this is what I'm continuing with overnight as well. So I do CAPD at night. So I prepare the machine at about 9 or 10 p.m. and then go on to that dialysis at about 11 p.m. And it takes 8 to 8.5 hours to complete that dialysis, and about half an hour to come off the machine in the morning. So if there's anything that I've learned through this whole journey, it is that this whole process is not straightforward at all. There's not one person that I've talked to who said that everything has gone really well for them, like they've had either a fistula put in or a catheter, and everything's worked really well. They've just gone straight onto dialysis and been able to do dialysis and survive and be fine. There's always some mode of complication where there's some kind of blood clot or some type of fainting, seizure, or their catheter doesn't work properly, their fistula doesn't work properly, so they have to have multiple surgeries in order to get it to keep working. And I'm not trying to be pessimistic, but it's just something that you have to be realistic about and have the expectation that everything is not just going to work out fine when you have dialysis or you have organ failure. And the thing about organ failure and kidney transplantation is that once you've had one organ fail, it's likely that you're going to have multiple organ failure because your kidneys and, for example, your heart and lungs are very closely interconnected. So once one fails, it's likely that the other will fail as well, unless you take proper care of yourself during the process of dialysis and when you have a transplant as well. You're also likely to develop a lot of comorbidities such as diabetes and high blood pressure. So it's very important that you take your medications and you control what you eat, your diet, and how much you exercise as well. It's also important that you look after yourself when you have a kidney transplant or really any organ transplant because the graft that is made between an organ and an artery is it's extremely important. It doesn't matter what organ it is, whether it's the heart, lungs, liver, or kidney. It doesn't matter how big the organ is, but it's that graft that is made between the artery and the transplant that allows blood flow and nutrients and vitamins and things to flow between the arteries, veins, and organs. That is the point which is attacked when organ is being rejected by the body. And when your kidney transplant does fail, when they say you have to take immunosuppression for life, they really do mean for your whole life. So at the moment, I'm still on some anti-rejection medications to make sure that my body does not reject my kidney transplant, even though it has failed. There can still be antibody-mediated rejection, and this can cause a hot kidney or a hot organ, which is when your antibodies attack that organ, and it can cause extreme pain and distress to you, and it can mean that you will need another major surgery to have that kidney transplant or organ removed, whatever it is. Um, so I hope this video has been educational and for people who may have an organ transplant, what it involves after your organ may unfortunately fail or be rejected. Obviously, for other transplants, such as a heart or lung transplant, it can be fatal. However, for a kidney transplant, at least we have something like dialysis that can allow us to live for a longer period of time to get another transplant. And even after your heart or lungs may be failing, they can get you on another transplant list. Dialysis is not something to make you suffer, but it's something to help you to keep living, so that you can one day again get another transplant and live your life again. So it's very likely that you're going to need another kidney transplant. So say you're in your teenage years and you get a kidney transplant. If that transplant lasts for another 10, 20, or 30 years, then you're still going to need the organ transplant when you're about 40 or 50 years of age. So that's why it's very important that we spread awareness about organ donation and transplantation, so that more people decide to donate their organs, whether it's a live donor transplant or deceased donor transplant, but just making sure that they sign up to the process. And throughout this process, I am extremely fortunate and lucky that I have and had such a supportive social system in place. So my family have always been there for me, whether it's just to say that everything is going to be okay, and that's all you need sometimes, but they have done that and more. For example, my sister had decided to donate her kidney to me, which I am extremely grateful for, and which without I would not have maybe even survived this long. My all my family have been very supportive, and all my well wishers have also been very supportive and helpful. Again, so it's extremely important that you talk about organ donation with your family members. As in the UK, we have the opt-out system. However, at the end, it's up to the family to decide whether your organs are donated. So it's very important that you discuss with them if you want your organs to be donated in the unfortunate circumstance that you do pass away. And you do have a look online to see what the opt-out system is, so that you can sign up. And if you do want to be a live kidney donor, then please do message me, and you'll be helping someone to come off of dialysis, and saving someone's life. Finally, I wanted to say that if you do have chronic kidney disease or kidney failure, then try not to worry as much as possible, because there are people out there who are really working in the NHS or other medical environments to help you to get an organ transplant, which will ultimately help you to live. Thanks everyone for watching this video series. I hope these videos help someone who might have to go into dialysis, or if they have an organ transplant already or kidney transplant, they'll know what happens during the transplant, before and after as well. I really hope that I can make a part 4 to these videos, where hopefully I'll get a transplant at some point, a kidney transplant, and can explain my journey after that. Please do like and subscribe to my videos, and comment maybe if you would like to. Thank you.